turning on the recording. Okay, and thank you so much for joining us for Talking Data Equity on July 29th. My name is Heather Krause, and I'm the founder of We All Count, which is a project for equity in data science. And one of the things we do is host something most Fridays at noon Toronto time, which is called Talking Data Equity. And this gives us a chance to kind of get together as a community, as people in all kinds of sectors and all kinds of time zones who are working out how to actually align the data work that we're doing with our equity goals. And a lot of times on these Fridays, we have special guests, and we do have a special guest today, and I'll introduce you to her in just a minute. But before, let me just tell you a little bit about the housekeeping logistics. Anybody's welcome to come to Talking Data Equity. The Zoom link is the same for all the Fridays. So if you have the Zoom link once, you have all of the Zoom links. And we go for about 55 minutes. We go till about 5 minutes to 1 so that you can all have time to breathe before your 1 o'clock. And it's just an informal conversation. So our guest today is going to tell us a little bit about her work and some experiences she's had. And then after she talks for a little while, we're going to open it up into live Q&A. And because this is a meeting with a lot of people, we ask that you stay muted while our guest is talking. And if you have questions that come to your mind while Sara Jaye's talking, feel free to put them into the chat, but we're not going to pause and address the questions until we get to the Q&A period. But you can put questions in at any point when they're in your mind, so you don't have to store them up. Then during the live Q&A, you can either ask questions by typing them into the chat, either publicly or just direct message them to me in the chat. Or during the live Q&A, if you want to unmute yourself and ask your question out loud, which we highly encourage, just raise your hand and we'll unmute you. So on that note, let me welcome our special guest, Sara Jaye Sandford, who is an epidemiologist in the public health sector at the Seattle and King County Department of Health. If you are not familiar with Seattle and King County, that is like the top northwest corner of the United States. And Sara Jaye, she does all kinds of things, which you'll hear about. She does things like develop trainings, develop workshops, and provide technical assistance directly to all of the community partners in the Seattle and King County area. So on that note, let me just turn it right over to Sara Jaye and say thank you so much for joining us. And I know lots of people are specifically tuning in to hear about your project.
Thank you so much, Heather. It's really a pleasure and an honor to be with this group. I'm going to be focusing today on my experience developing data biographies. And as Heather mentioned, I am an epidemiologist for Public Health Seattle King County in our Assessment Policy Development and Evaluation Unit. And let me get my slides going here. You can also see here the logo for Communities Count, which is a public-private partnership that's staffed based in our team at the health department that I get to work on. And it's a resource that supports King County communities in using data to promote equity by providing data resources and trainings and sharing data on disparities, inequities, and strengths in our community. So before I dig more into that, I'd like to take a moment to make a land acknowledgement, knowing that this statement is one very small step against the erasure of our Native communities. I'm working today on the ancestral land of the first people of Seattle, the Duwamish people, and the community that I serve, King County, is also home to the Muckleshoot, Snoqualmie, and Tulalip tribes and other Coast Salish tribes. Today, King County is home to a vibrant and diverse community of Indigenous people from across North America and indeed across the globe. And so we honor with gratitude the land itself, the Duwamish tribe who has stewarded this land since time immemorial, and all the Indigenous people that call King County home today. So I will tell you a little bit more about myself. My background is actually not from a data place or even a public health place. I actually studied English, women's studies, and LGBT studies in undergrad, which I loved and I think has been incredibly impactful in how I approach my public health and data work because it taught me the value of critical thinking, intersectionality, and valuing multiple ways of knowing. So from there, I went on to work in women's and LGBTQ community health organizations and decided to go back to grad school, got my master's in public health in a program called Community Oriented Public Health Practice at UW. So it's really specifically designed to be doing work in communities outside of academia or research per se. And after about a decade in the nonprofit sector, I joined Public Health Seattle King County as an epidemiologist. And over this time, I've had the opportunity to work in HIV prevention, tobacco cessation, immunization promotion, maternal child health. And I'm especially passionate about health equity and LGBT community health. And in kind of my own professional journey around data and data equity, when I started working in LGBTQ community health 15 years ago, I would be grant writing and there was just no data outside of gay men and HIV, STI. There was very little data that addressed what we knew through our lived experiences were the health inequities that our community was enduring. And now there's so much more data. There's still so far to go, but there's so much more than there was addressing LGBTQ communities and health. And I get to be a very small part of working on how that data is collected, analyzed, and used. So that has been a very cool journey and very, very much informs kind of my approach to being a little bit on the outside and a little bit on the inside of how we use data for community health. So that was me. I'm going to talk a little bit more about King County. As Heather said, we are in the very far Northwest. We are on a really good traffic day, less than 2 hours drive to the Canadian border. We serve a population of 2.2 million people. We're the largest county in Washington, and our population is actually larger than that of 15 states. I want to say geographically, we're also larger than Little Delaware and Rhode Island. We have 39 cities, the largest of which is Seattle with over 700,000 residents, and 25% of our community members here are coming to us from countries outside the US across the globe. Oops, sorry. This is a place that in many ways experiences a lot of prosperity, but also very high cost of living and a lot of inequities in who has access to that kind of prosperity. So housing prices are very high. In 2020, it was almost $750,000 for the median home price, and that's only gone up. Similarly, household income is also high. It was $112,600 in 2020, and amazingly, that's also inched a bit up in the last couple of years. That being said, we see 25% of our households with income under $50,000. There's a lot of nuances about household size, but to me, that $50,000 really can barely be considered a living wage for any household in a place with cost of living as high as ours. We have 7.6% of households below the federal poverty level and an increasing homelessness crisis that's been growing for quite some time. So we have a lot of amazing resources and a lot of inequities as well in our community and communities that we serve. So this organization chart tells you a little bit about what kind of services the health department does. And so specifically, I wanted to share a little bit about my unit because it really informed why we decided to do some data biography work and how we went about that. This text is super tiny, so I'm going to read you our little official blurb. The assessment, policy development, and evaluation unit's primary work is assessment and evaluation of population-based data and interventions, integrating qualitative and quantitative analysis. We are a multidisciplinary group of epidemiologists and social research scientists. We collaborate with community and King County divisions, using and developing state-of-the-art techniques for data collection and analysis. Our goal is to provide leadership and technical assistance for population-level health assessment, data-driven program planning, program evaluation, and policy. So TLDR version, we use data to assess and address community health in King County, basically outside of infectious disease, which is managed by some colleagues of ours in another unit. That being said, of course, we've all gotten roped into COVID work over the last couple of years, but our wheelhouse is basically public health assessment, and that can include chronic disease, violence and injury, social determinants of health, again, pretty much anything outside of infectious disease surveillance. So how do we do that? We use data from lots of different sources. And if this slide looks a little wild, it's meant to, because our data sources are very different too. They come in all shapes and sizes. This is just a small sampling of the data that we work with. And it includes administrative data from government programs like unemployment, public education, Medicaid. It also includes survey data, vital statistics, and much more. So where do we get this data? It comes to us from many different data owners or data stewards. And again, this is just a small sample of folks that share their data with us. And as you can see, again, it's a little bit of a crazy quilt. Each of the entities that shares data with us collects their data in different ways and for different purposes. And that really informs how we are able to work with it. Really, only a little bit of our data is actually collected by us here at the health department. So we have all this data coming to us from so many places, and then we in turn disseminate it in many ways, including reports, infographics, and the uncannily popular online dashboard. Most of these products that we put out integrate data from multiple different sources. And again, this is just a sample. What you see here includes our community health needs assessment, community health indicators, social and economic impacts of COVID dashboard, city health profiles, health and housing dashboard, health impacts of firearms dashboard, just to give you some kind of idea of the work that we do. But with each of these products, we also have different audiences ranging from partners in local government and healthcare to community organizations and the general public. So we've put all this stuff out there. And again, if my slides so far have been a bit of a busy mess, that's intentional because maybe they've looked like a lot to take in, or it's been kind of unclear what's the relationship between these different things on one slide or across slides. And I think that many users who attempt to navigate our data resources may have a similarly confusing or overwhelming experience. So we get lots of questions, but there's one that comes up most frequently. Where does this data come from? And of course, we always cite our sources. But simply saying the American Community Survey or Washington State Office of Financial Management doesn't tell anyone what they really need to know to understand the strengths and limitations of the data that they're looking at, who's represented and who might be excluded. And my theory is that underlying this question and a lot of other questions that we get, what people really want to know is, can I trust this data to accurately represent my community? So a couple years ago, our team did a training with We All Count, and we learned about data biographies and decided to try using this as a tool to address these kind of questions in a consistent and transparent way. So we set up a process. We knew it would be a lot of work, and as they say, teamwork makes the dream work. So we created our first batch of 6 biographies for some of our most commonly used data sources last winter, with a team that included myself and a colleague who also does a lot of dissemination support, and some new epidemiologists who had recently joined our team. And we worked together to create and refine a template and come up with some common language in standards, like how do we explain survey weighting? Do we want to use past tense or present tense? And we hope to continue always improving and iterating on those, but having that has really helped smooth the process. So using that template, our staff drafted biographies using internal and external documentation, and then also collaborated with a different team member who had worked with that data set for years, somebody who was really a subject matter expert to answer questions that came up for them that they couldn't find or found unclear in the documentation. And then also we edited them all for really, I always consider this aspirational, but really clear, non-technical, jargon-free language so that any community member that wanted to be digging in to our data and understand our data sources could find it clear and accessible, regardless of their background in data work. So we created them, we put them online. I'll show a link to that in just a moment, but we also linked directly to them in a lot of our data products because we really wanted folks to go straight from where they might have that question to getting some answers. So I mentioned the template. It's built around questions that we consider the most basic and important about any data source, using inspiration from examples shared by We All Count. And those questions were: who collects the data, who owns the data, how is the data collected, who's included and excluded from the data, where is the data collected, why is the data collected, how often is the data collected, what else is important to know about this data, where can I learn more about this data, and then a data privacy and security statement. So a key goal of data biographies for us was really to provide information that's clear and accessible to community members. And part of that is not overwhelming folks with way more detail than they're interested in. So you can imagine that sticking to a hard limit maximum of 2 pages kept the answers to each of these questions pretty brief and straightforward. And we are a bunch of data nerds, and we always want to give more detail, more technical information. And so this was an exercise for us in really moving against our instincts and operating, I think, in a different way. And again, there's always, I think, room to improve, but we really strived for jargon-free, non-technical, accessible language as well. So we posted them on Communities Count. This platform really gives us a lot more flexibility and is a lot more user-friendly for folks than some of our official kingcounty.gov websites. So you can find them at this URL or use that QR code on your screen if you're interested in checking them out. So we made these data biographies. We shared them with the world. How did it go? We actually found so many unexpected benefits, especially for our team, of working through this process together. As I mentioned, we really used it as an opportunity to onboard new colleagues to data sources that they'll be using. So it was really helpful opportunity for them to have some dedicated time to explore understanding some of our data sources, especially since in my unit we're mostly remote most of the time. It was a really nice opportunity to collaborate with folks who might not otherwise work together, and for new staff to connect with people they might not otherwise meet. We're not seeing each other in a break room or an elevator anymore. So that kind of collaboration opportunity, I think really helps as we try to keep building a positive workplace culture in a remote environment. I was surprised to actually learn about data sources that I've been using for years. So one little example of this is the birth data, the birth certificate data. It's part of our vital statistics data. And when this data comes to us, it includes lots of information about the health conditions surrounding a birth regarding the birth parent and the baby. So it's not just, a baby was born on this day to this person. We get, were they a healthy birth weight or a low birth weight? Was the birth parent able to access early and adequate prenatal care? Did the birth parent smoke? Did the birth parent have overweight or obese BMI? There's tons of data elements that come to us with those birth certificates. And I actually didn't know, despite having used this data for years, that there is no standardization for how the hospitals and birth centers that report this gather this information. So they all have to report the same thing, but different healthcare systems may be pulling different information from their electronic medical records versus getting them from a patient interview versus having it reported by somebody on the healthcare team. However they want to get that information, they could do it. So different data elements might be gathered in really different ways in different systems. And I feel like that could definitely impact how we interpret those results. And so I was surprised to be learning more about data that I thought I knew pretty well. I will also say that in our attempt to find answers to these questions that we had thought were really basic, straightforward questions about any data source, it was often really difficult, even in extensive technical documentation that our team had or that the data owners had. Oftentimes these questions were not directly addressed, and especially issues surrounding possible power dynamics were not directly addressed. And oftentimes when we did find it, it was like, well, I clicked through 27 different pages within the State Department of Health website, downloaded 3 different PDFs, and found it on page 97. So it really underscored for me the need for a resource like this that is more clear, more straightforward, and more accessible to a lay audience. You know, one of our mottos in our unit is data democracy. And I think if we want to democratize data, we have to help people who are curious about data sources who, you know, may not have a technical background, but they bring that critical thinking and curiosity, give them information that they want in a way that's accessible to them. So I'm hoping that it's really valuable. But these benefits that I've mentioned, you know, really were for us internally. And what I'm looking forward to learning more about going forward is whether we're reaching the first goal that we started out with, which was providing clear and transparent information to our data users. Are they finding our data biographies, and are the biographies answering their questions? So moving forward, we're going to be disseminating the biographies more to some of our data users and partners, including we have an informal King County Communities Count user group of folks that get together and use our data, that share feedback and ideas with us. We're already hard at work on our next batch of data biographies. And hopefully we'll continue to adapt them as we change how we use and share data. So just kind of imagining the future, you know, some things we don't do now, but that we could do is like if we move towards a more query-based system for sharing some of our health data, or if we were to start contributing to open data portals, how could data biographies adapt to support users in new ways? And finally, I wanted to mention that the data biographies are just one part of much broader efforts towards data equity work in our unit. And we see it as a piece that can be helpful kind of across audiences and across projects, because, you know, these questions about like, where's your data come from? How trustworthy should I really find it? Come up in so many different contexts. But again, it's just one piece of our data equity work. And this is a partial list of some other things that I've had the opportunity to contribute to over the past couple of years. And that includes doing participatory data interpretation. We're embarking now on some community-led data collection, analysis, and dissemination. We've made a lot of changes to how we ask about race, ethnicity, sexual orientation, and gender identity on surveys that we use. I do a lot of work around building the capacity of community partners to find, create, and use data. We're trying to build out more multilingual data collection and dissemination, always focused on integrating qualitative and quantitative data. I work with some amazing qualitative researchers, so having that multidisciplinary team is such an awesome opportunity. We think it's really important to provide historical context for the health disparities that we report out, so they're not interpreted in a pathologizing way towards communities that are experiencing those disparities. So to that end, we're creating a local timeline of policies and events that have impacted health equity. And we also have been working on collecting and sharing data about local BIPOC communities' experiences of racism. And if any of that sounds interesting to you, please do ask about it in the chat and the Q&A. So I love talking about all this stuff. Please don't hesitate to reach out. You can contact me directly. And I also dropped in here contact for our communities count team, and our unit as a whole has a data request inbox that we monitor. You can reach out about any of this work that way as well. So I think that we're ready for some discussion.
Thank you so much, Sara Jaye. And in fact, all those things that you have on your kind of next steps list sound extremely interesting. I was madly taking notes. I'm like, follow up when these things are ready, because I want to see them or just how you're doing them. Thank you so much. I really appreciate you sharing that. And as you know, when I saw those data biographies go live on your site, it was a very joyful day here in the We All Count office to see that. And we know for sure that health departments from lots of other states have been checking them out, because we keep hearing from them. So, I think I don't know what kind of direct feedback you're getting, but I just really wanted to make sure that you knew that other health agencies are absolutely using that as a best in class example and working to follow your lead. So we have a couple of questions in the chat, but before I do any of the chat questions, I'm going to pause and see. This is the wide open Q&A time. And so you have a couple of different ways you can ask questions. You can raise your hand and we will unmute you, and you can just ask your question directly to Sara Jaye. Or if you would prefer, you can put your question into the chat using either the drop-down menu set to everyone, which means that everybody who's here will be able to see your question. Or if you would rather remain private, you can just direct message it to me in the Zoom chat. So I'm going to pause and see if anybody in the room would like to raise their hand before I go to the chat questions. Or sometimes also, almost every week, we get questions submitted in advance because there's lots of people who just can't come at this time for a variety of reasons. All right, we have some +1s to Wendy's question. So let's do this question, which is, I am interested in hearing more about the timeline you all are creating of policies and the impact public health had for particular populations. A brief overview process, and how far back are you looking, what form you'll share it in. So Sara Jaye, she's asking about this one of the bottom items on your list of the broader data equity work, creating local timeline of policy and events that have impacted health equity. How far back are you going back, and what's your process?
That is a great question. This is something I can't show you yet, but we're hoping to publish it on Communities Count later this summer. So if you sign up for our newsletter, we don't send it out that often, so we won't be spamming you, but you would get a chance to see it when it does go live. This kind of started as a dream. It started with an acknowledgement that something we don't do a good job at, frankly, is providing a lot of context around the data that we share. And when you just dump all this data out here, especially when we see such consistent health disparities, and that's not in any way unique to King County, it can really be interpreted as in a deficit-based way towards the communities that are experiencing those disparities. And that's not our understanding in APDE or in public health, but it's on the internet. Anybody can read it and of course still think whatever they want. So we really wanted to try to do a better job helping to provide context about where do those disparities come from? It's not the deficits of the communities experiencing them, it's specific structural policies and events. And I think that there might be a kind of broad-based understanding about that. I think we're in a unique, everyone's in a unique context. Everything is local. I think that in my experience living in the Pacific Northwest and I've lived here for about 12 years, but I grew up in the DC area. I think especially, just to be really transparent, a lot of white people in the Pacific Northwest have viewed racism as something that has happened in the South in the US. And that's just not true. And we wanted to really ground, we always try to share data that is geographically as specific as possible. We don't just share data for King County or even for like the city of Seattle. Whenever possible, we're showing it for small geographic areas. So we wanted to be able to share the context that impacts that data in also a really specific way and show that these are things that have happened for centuries in our communities. It's not just federal policies. It's not just something that happened in the South. So that was kind of this discussion we were having of, we have this understanding. We want to provide, providing that kind of context is kind of a best practice that we weren't doing very well. So we thought, wouldn't it be cool if we had a timeline of local policies? And then we thought, wouldn't it be cool if we got some students to work on this with us? So in Communities Count, we have had an awesome team with 2 public health graduate students, one of whom is a paid work study student. She also does a lot of the grunt work that keeps our website going. And then another practicum student. So she wasn't paid, but she got required course credits for her participation. We did a lot of kind of framework setting at first to decide what should go in, like it should be local, it should have a clear connection, or at least a connection that we can make to health equity data that we share. We use a framework around social determinants of health, so something that impacted the built environment, education, access to economic opportunity, and we set them to work. We provided a few resources, and they researched local history. They created a very long and detailed timeline, and we then shared it out with some community partners as well as internal subject matter experts in the health department to say, does this reflect your community in the way you would want to see your community reflected here? Are there any big issues that we're missing or communities that we're missing? And another thing that we really tried to do throughout the process is not just highlight some of the really negative events that have impacted communities locally here. So just like for a couple examples, there were actually white unionized workers that rioted in the 1880s and 1890s to prevent Chinese American workers from being able to find employment in Seattle, and were successful in their policy goals. The confinement of Japanese Americans in concentration camps during World War II had a huge impact locally. I mean, it shattered the community that had been in Seattle for well over 100 years at that point in time. So, we think those things are really important, but we also really wanted to include in the timeline the ways that communities were fighting for their own well-being. So we included things like the activism that happened in Seattle in the 60s around fair housing and some of the leadership from Black and Asian communities and coalition building across communities of color that happened around that. So we didn't want to just take a deficit-based approach. We wanted to show the resilience of communities and their agency as well. So those are some of the frameworks that went into it. As far as how back we went, colonization has had a huge impact, especially on Indigenous communities here. So that's how far we went back. I think the first item in the timeline is going to be Vancouver's voyage in the 1770s.
Oh my God.
But we only want to have like 50 items on the timeline. So we're like in that culling process now.
That is amazing. I like it. Best case scenario, I was thinking, 70s, maybe 1970s. So this is amazing. And we're going to I would like to book you now to come back and talk to us about that because yeah.
I will send you Wendy and Cassidy, our amazing students, because it's really their work.
Great. Yes. Fabulous. Well, I'm looking forward to that. And that is going to be an incredibly valuable resource for anybody trying to, destigmatize differences and point it out. So that's super exciting. Way to go. So one of the questions that's coming in really regularly to the chat about the topic that you've just been talking about, the timeline, as well as the data equity, is what's your theory on how your organization, your organization is a public organization, so you're not, not trying to figure out what to do with your buckets and buckets of cash and all your free time. So how are you successfully getting so much resources devoted to these kind of projects in a public health setting in a pandemic?
Yeah, that is a really good question. I will say that the data biographies and the timeline are both examples of labors of love. Those projects, were not resourced outside of the blood, sweat, and tears of our team members who made time for them.
So does that mean nights and weekends? Like not being done? Oh, okay. So it's still being done within your work time.
Yeah. We're unionized. Okay. We all work unpaid overtime because we just can't help ourselves and we care so much about public health, but we try to minimize that. Don't tell my union president that I said we do that, but he knows it's true. But yeah, so we just make time for this. And honestly, especially when something's like unfunded, a double-edged sword is that there's so much flexibility, there's nothing to hold us accountable, but that, the process of working on these data biographies, they're all 2 pages and it was like a 6-month process. So people had a lot. It was like, okay, can you draft something in the next 6 weeks? And then maybe a couple weeks for somebody else to review it with you. So we just kind of have shoehorned things in. I think that the value that we place on equity is what allows us to make time for those things. So it's, health equity is really our mission, and our health department, like many others, has publicly committed to addressing racism as a public health crisis. And I think the combination of internal commitment on our staff to incorporating data equity and the leadership of saying how important, addressing racism creates an environment where we can make time for these. I will say that another thing that has funded quite a few of the items on this list, which reflects, my work more than other people's work on the team. So it's partly just because this is what I do, but you might notice on my background, there's a little catchphrase, happy, healthy, safe, and thriving. A lot of this work is funded by an initiative called Best Starts for Kids. It's a property tax voter approved initiative. So we are fortunate to live in a space where politically our residents are willing to vote to tax themselves to provide I think we're on average, depends on property values, but like over $80 million a year of funding for services for children, youth, and families in our community. And so a lot of items on here have been funded out of the evaluation of that because it's a really equity-driven program. And internally, we view that initiative as a way to create internal change in how we operate as a county government to be more equitable. So just being part of a community where people are willing to dedicate resources to health and equity is part of why I feel so lucky to live and work here.
Yeah, and that's a very good point. It is very, of course, context specific. And I was just on a call yesterday getting ready to do a presentation to a national organization that has a lot of state representatives, and some of the state representatives were on the preparation call, and they said, we are not allowed to use the word equity. And these were also health departments. And so that's one of the really great things about the data biography tool is that a data biography tool is, as Sara Jaye is talking about, an incredibly powerful tool for equity, but it doesn't have to be framed as that. It's also an incredibly powerful tool for accuracy, efficiency, and effective research. So there's lots of ways. If you're coming from a community where people are not taxing themselves to do equity work, you can do something like put together data biographies for the data that you're using without using the word equity, under the objective of having more accurate, more efficient, more cost-effective research. Because as you were saying, even I've never been part of a data biography process where even an expert who has been working with this data for their entire career hasn't found places where they were making assumptions about what was actually in that data. Go ahead.
I just would add, this is maybe I shouldn't theorize because again, I've lived in Seattle for about 12 years now, but I think a lot of this too, we frame it as equity. We see it as foundational to our equity work, but could be framed in a more perhaps neutral way of just incorporating communities into our work. And I think, like, at least from the very, frankly, few conservatives in my life, but having that power shift directly to community members in a way, for me as a technocrat, is not something they are opposed to. So like integrating qualitative and quantitative data, we view that as an opportunity for equity where people who might not be well reflected in the quantitative data get to contribute, where all that context can come in. But it also can just be a way of saying, hey, we are not the only experts. The one data source is not the one data source to rule them all. We need to ground this in our communities. We need to ground this in the residents that we are serving.
Yeah, that's such a good point. So if somebody here would like to start a data biography crafting initiative of their own, it can feel really overwhelming to start, to see you being kind of finished phase one of this. What would you recommend as a good first step?
I think for us, it was really helpful to define like our audience that we wanted to reach with these. Just one of our, for me personally, at least, I feel like one of our biggest challenges, especially with like all these dashboard products we put out, is we're like, it's for everyone, and you're not serving everyone well when that's your approach. So the fact, and we looked at several, there was like really different examples that your team provided to us, Heather, in the training and on the We All Count website. And some of them were more technical than others. And we decided we really want this to be able to answer like a question that we get from any community partner. So it has to be written out. It's not going to be a spreadsheet. It can't be too long. Like that decision of who we wanted this to best serve was really what all the other decisions flowed from. So I think that's a good first step. And then creating the template, there's a lot of examples out there. You can look at the stuff from We All Count. You can look at ours. It really wasn't that hard once we knew what we were trying to do.
Great. That's a great suggestion for a first step. Gonna just see if anybody wants to raise their hand, or I will continue on with the chat questions. One of the chat questions is, do you have a county-wide kind of table or group of researchers that meet regularly from a variety of agencies, or most of the discussion happening within your county Department of Health?
We don't really have a good county-wide table for that kind of work. We used to have, let's see, if I go over to this, again, very complicated and yet oversimplified org chart. There are data people in most of these other units. We don't handle the jail health services data or the WIC data or the environmental health data or the infectious disease data. So we did used to have an all epi meeting, and then COVID happened and all the epis were really, 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 really busy all the time. So we're just now trying to get that reimagined and connect with our partners in, other local governments like City of Seattle, as well as some of the researchers at UW that do more practice-based research as well. University of Washington, which is our local big university.
Yeah, excellent. One of the direct message questions that, in case you're wondering why, sometimes people on the call are like, I can't see these questions, and that's because they send them only to me sometimes. So are you saying that you have two different versions of data biographies or data dashboards for different audiences, or that you decide on kind of the main audience for each product and create a single product that's optimized for your audience?
There have been times when we're able to make different products for different audiences. Most often we're not. I mean, most often, honestly, it's like an online dashboard that's for everyone, and certain data savvy partners find it great and love it, and everyone else is like, what am I looking?
Yeah.
There's only one version of the data biographies. There are some other products where we might have a dashboard or a report, but we also create like a little newsletter, a little executive summary, or a little infographic to provide that. A communication framework that I try to think about that comes from public health is like bite, snack, meal. So you have an audience who just wants like, give me the headline, give me the first paragraph, like give me the whole thing. And so we try to think about kind of like triaging our communication products along the lines to meet those different needs.
Got it.
Here's how, here's the main thing. If you want more, here's how to get more. If you want even more, here's how to get more.
That is awesome. I've never heard that bite snack meal. I guess it probably goes in that order. Yeah. That's very cool. So for following up on your specific example about the birth data that you figured out could be reported in lots of different ways, is there any way to tell if you are using like the large aggregate data set, how each local area collected the data? Are you able to tell which data came from focus groups, which data came from like a health quantitative database?
Nope.
You aren't.
Nope. And I think, in King County, we have a really big population. I wonder too, thinking more at like a statewide level, there are very rural communities where everyone in multiple counties is getting served by one healthcare system. So if that one healthcare system is, they have their practices for how they collect and report that data, I feel like that's where one example of where it could really skew results.
Right.
When everybody in, when a whole swath of the state is getting reported one way, that might be really distinct from places with more mixed methods.
Right. I think we could take the might right out of that sentence. For sure. That's going to be, I mean, that's very, very interesting to me. And I'm delighted to hear that you uncovered that. And so now we all know that when we're using that, because I think I'm sure that's something most people do not know. I think that we will end on one question that two people have submitted directly to me, and that is, how could we support you or maybe collaborate with you on this project, if possible?
Honestly, what I would love, what would be so helpful is if you use these data biographies in any way, some of the data that we have biographied, that's not a verb, but
Seems
some
good.
of it is
should be a verb.
Really, like the American Community Survey, lots of people outside public health and across the country use that. So if you have found our data biographies useful to help you understand a data source that you use, or if you have found it a helpful model in a project that you're working on in any way, let us know, because it's, we put these things out into the universe, and then it feels like a black hole to me sometimes of like, how are they landing? So if you have any examples of how this is helpful to you, or even questions about them, just shoot me a really short email and let me know. And then I'll be able to share out with my team, like, yeah, this was worth it because people are actually using these, which is hard to figure out, like in a way besides like web hits sometimes, which
First,
yeah.
can you put the slide back on? People are asking
Yes.
for the slide where they can, because I know for sure there are people on this call that are already benefiting and actively using these. So the email slide where they
Yeah.
can tell you that that's the one where we can send you all of this, all of the praise and feedback so that you can keep being allowed to use your hours and hopefully continue to get support. Okay, we are going to leave it there because one of the things that we've gotten a lot of feedback on is that it would be a lot more pleasant if we could end at 5 minutes before the hour so that people have that 5 minutes to breathe or eat their lunch or whatever. So we are going to wrap it up now. And first thing I'm going to say is that we will link to all of the materials that were shared here, and we'll also share the video once it's ready. At this site, the first thing I typed in by hand didn't work, but here's a real link that will work, and you can find it all there. The other thing I'm going to put into the chat is a link to places where you can submit questions for upcoming Talking Data Equity sessions. We're actively preparing our fall session now. So if you have questions or things that you want to talk about in an upcoming data equity, feel free to do that now. And next week, next Friday, we are going to be talking about statistical significance and p-values and how they can help and how they can hurt equity. So it'll be a bit of a technical talk, but absolutely we will also be talking in very non-technical language to work out what exactly is a p-value and does it actually ever help us, and if so, how. So that's next Friday at noon Toronto time. And I think we'll leave it there with a tremendous thank you to Sara Jaye, not only for coming today and sharing with us your experience and your resources and a sneak peek into your upcoming resources when we will have you back, but for doing all this work, for having the idea and making it happen. That is an incredibly valuable contribution to the world and to the practice of data equity. And we are so extremely grateful for both.
Thank you so much. It was such a pleasure to connect with you all here today.
All right. So hope everyone has a good rest of your day. For those of you who are heading into a weekend, have a lovely weekend. And if you feel like joining us next Friday at noon Toronto time, the Zoom link is the same Zoom link, and we'll see you then. Okay, bye everyone.